One of the common complaints I see in my daily gastroenterology practice is to do with piles, or what we call as hemorrhoids in medical terms. What are piles? Piles are swollen, enlarged blood vessels. Like imagine we have veins on our hand, on the back of our hand. So these kind of veins, when they get enlarged in the lower part of the rectum, which is the last part of our large intestine, or in the anal opening, the back passage, they get swollen. They can cause discomfort, itching, irritation, and also bleeding. When we talk about piles, there are two types of piles, because some people say that I cannot feel anything, how can it be piles? These are what we call as internal piles or hemorrhoids, because they develop inside the rectum. So you might not actually feel it when you are washing your bottom or when you are wiping, because they are internal. And generally they are not painful because there are many pain receptors in that area to cause any pain or much in the way of discomfort. They tend to cause more of painless bleeding, especially when you are straining or when a hard stool irritates or rubs against it. It can cause fresh blood that can be either mixed with the stool, or often the blood can start dripping once you have passed the motion. So these internal hemorrhoids, they don't cause much in the way of pain. The external hemorrhoids, or what is that you can feel or sometimes you can notice, this are in the anal opening. They are around the skin in the back passage. They can be painful sometimes because there are a lot of pain receptors in the area, in the anal area, and this itself can get sometimes swollen, red, inflamed, and sensitive, which can cause discomfort even for sitting or walking, or every time you pass motion, it can be uncomfortable. So these external piles are the ones which people notice that there is something protruding when they come to see us. With regards to the internal hemorrhoids, because they are not visible to you or you can't feel them, some people will find it unusual that the bleeding can be piles because they can't see it. There are 4 grades in these piles or hemorrhoids. Grade 1 is the internal one, the one in the rectum that a doctor or somebody has to examine and feel them. Sometimes we have to put a tiny tube inside called proctoscope so that we can take a quick look. Grade 2 piles, or that protrudes through the bottom when you are straining, but it just goes back inside on its own without you doing anything once you pass the motion. This happens in a lot of people where they really don't need to do anything. Once the stool has passed, it seems to return back to normality. Grade 3 is the one where the piles has come outside and you having to put finger to push it back. Some people, we see this kind of complaint where they have been putting it up for years together because it has not been bothering much, because they've been able to push it inside, manually reduce it, and once they have pushed it back inside until they pass the next motion, they feel absolutely fine. So they have been kind of delaying it for months or years together. The grade 4 is the worst one because the piles essentially has completely come outside and you cannot actually push it back in. This can interfere with your sitting, and generally this kind of a grade 4 or advanced piles require some kind of an intervention. Sometimes these external piles, they can get thrombosed. Thrombosed means, imagine like a blood clot. A blood clot can form in the blood vessel and block. So it's the same kind of blood clot can form in these piles, which is outside, and this can cause intense pain and swelling, which often requires urgent treatment. Why do some people develop piles? Piles can develop for a variety of reasons, but the common problem or the fundamental reason is the increased pressure in the veins in the bottom, in the rectum and the anal area. So where does this pressure come from? What are the risk factors? If you are someone who is repeatedly straining, putting pressure or pushing hard to pass motion, you can be either suffering from chronic constipation, or even sometimes you can actually be having frequent diarrhea. This also can start causing irritation. So if you are straining during the stool, this puts abnormal pressure on the veins, these blood vessels in the rectum and anus. This increases your chance of developing piles. In women, of course, in pregnancy, hormonal changes, and also when the baby is growing in the uterus, there is pressure from the baby itself on the veins in the rectum, and quite a few women during pregnancy develop piles. This tends to be more in the later part of the pregnancy, towards the 7th, 8th, 9th month. Being overweight, being obese, is also a risk factor for development of piles because of pressure it is exerted on the pelvic veins. Age is, of course, a factor in all these, and we previously didn't used to see that many young people with piles. Nowadays, in cities like Bangalore, we are seeing a lot of younger people suffering from hemorrhoids, piles. So as people age, the tissues that generally support the veins in the rectum and the anal opening, they can also lose the elasticity. It can weaken a little bit, making it more easy for these piles to develop. If you are suffering from chronic constipation or chronic diarrhea, both can cause the straining or irritation and increase the chances of you developing piles. One of the common issues nowadays in the cities is people, most of them are doing desk jobs where they are staying seated for hours together. And people who are actually spending a lot of time in the Western toilets, putting undue pressure on the rectal veins. Sometimes when they're going into the toilet, they're taking mobile phones inside, just sat watching stuff on the phone. So they're not concentrating on that defecation, on the movement of the motion. And this sometimes can become a habit. And there you're repetitively straining, which can lead to further problems. If you are someone who is lifting very heavy objects repeatedly from the floor, doing very heavy workouts in the gym, this can also lead to pressure in the anal area, and this can also be a risk factor. Some people commonly complain that a lot of their families have this, and they also hence have the same issue. Diet plays a very important role as well here, because if your diet is not great in terms of the fiber, this is one of the main issues nowadays where people are not consuming much in the way of fiber. This can actually cause constipation, making the stool harder, and sometimes having to go multiple times to pass stool. So each time passing small quantity of stool and having to repeatedly strain. What symptoms can someone expect from piles? As I mentioned, piles can be internal or external. Based on whether they are inside or outside, and based on the grading what I had mentioned from 1 to 4, the symptoms can vary. Common symptom what we expect is usually fresh rectal bleeding, blood that is bright red, which is usually something you might notice on a toilet paper or in the pan once you have passed the motion. And sometimes people notice that they have passed the stool, they have not actually realized, and suddenly they see the pan is all got a bit red because of the blood has just started to drip, drip and drip. So this tends to be one of the common symptoms. Do people with piles really get pain? Sometimes they are getting confused between piles and fissure. Fissure is like a cut, it's like a crack in the skin. So most of the piles do not actually cause pain unless you have external piles. So the piles that you can see or you can feel, which can sometimes be tender to touch, or if it is too painful to touch, this can be like a blood clot that has formed and what we call as thrombosed piles, and this can be quite painful. Itching or like irritation in the anal area is one of the common symptoms because the skin around the anus gets a little bit irritated. So this is a common complaint we see in a lot of people, and they're also complaining of they can feel a swelling or a lump or tenderness which is bothering them. And when the piles prolapse or when they bulge out, when they are straining, that certainly can cause some degree of discomfort. So most of the times it is not severe pain, it's more of a discomfort. One of the issues is also feeling of incomplete evacuation. So they go to the toilet, pass motion, and then they feel that they don't seem to have emptied or done the job properly, then having to go back again. Because of the internal hemorrhoids, internal piles, you can sometimes get that sensation that you're not emptying properly. Sometimes people self-diagnose this because they find stuff on the internet and start ignoring the symptoms. If you are noticing blood that is going repeatedly, do not just assume that it is piles, because there are variety of reasons for passing blood in the stool or passing fresh blood. You should take advice from a medical gastroenterologist. The gastroenterologist, of course, will inspect the anal area, and quite often we perform what we call as a digital rectal examination. So wearing gloves, putting some anesthetic jelly and examining inside to feel whether we can feel a lump inside, or whether it is a fissure, whether it is piles, hemorrhoids, or sometimes people mistake this extra growth of skin, what we call as skin tags, for piles. So there are a variety of conditions that can occur. So not everything in the anal area is piles.